Unfortunately, now we have to talk about the risks of surgery. Now, we do know that there are things that we can do to try to minimize the risks of surgery. The most important risk that we need to talk about is an infection. Any kind of metal implant we put in your body, it's not alive. It doesn't have the ability to fight off infection. It's just a chunk of metal that we've molded into a shape that can give you a better life through a knee replacement. But if it gets infected, it's a big problem. So how can we minimize the risk of infection? Well, number one, not everyone is a candidate for knee replacement. You have to be healthy enough to have a low risk profile for an infection. If you're a nicotine user, either with smoking or chewing tobacco or vapors or whatever it is that you're using, we request that you stop doing those for 2 months before surgery and 2 months after surgery because it does greatly increase your risk of infection. Diabetes is very prevalent today. If you have diabetes, you can still have your knee replaced, but you have to have it under control. So hemoglobin A1C level is kind of the standard of care of what we look at today. 7.5 or better, meaning below 7.5, is what we need to have joint replacement be an option. If your diabetes is uncontrolled, the risk of infection is too high, and unfortunately, you're not a candidate for joint replacement. Another thing is obesity. It's not that we don't love all of God's children, but unfortunately, if you have too much weight, your risk goes up for infection. Another one is diet. So it's very common that even if you're not overweight, you can be malnourished, which means that you're sick on the inside and your body doesn't have what's necessary to fight off infection. So sometimes we say, maybe you have to go work on your diet, increase your protein intake, get some vitamin D. All these things are very important to the healing process to minimize the risk of infection. Other things can be wound problems. If you have a huge history of wound complications, maybe your blood flow is too bad. Maybe you have a lot of surgical trauma to that leg from previous surgeries. Maybe you had a lot of accidents in the past. If you have problems with your skin, that's the number one barrier to prevent infection. So there's a lot of reasons why you can get infected, and this is very brief, and have a detailed discussion with your doctor is probably the next step, but realize infection is probably the big risk.